Prior to treating Lyme disease, I spent several years working in an urgent care. During one of my shifts, I met a patient who had just got done treating pneumonia. He had just got off an antibiotic and was feeling a little better, but not completely resolved. He was still having a productive cough, low-grade fever, shortness of breath. And I decided to get a chest x-ray to double check things and see what was going on. Chest x-ray looked perfectly normal. His lungs sounded good, but yet he still had symptoms. His oxygen was still a little bit low. Not exactly sure what to do with this case, I decided to talk it over with one of the internal medicine doctors who taught me something that has always stuck with me and I think really applies now that I'm treating more cases of Lyme disease and tick-borne diseases. What he said was, yeah, these tests and x-rays are not showing us anything, but he's still symptomatic. He still has symptoms, so his recommendation was that we continue to treat. And it seems obvious, right? Testing isn't perfect. Chest x-rays don't pick up every single case of pneumonia out there. You don't always hear it with a stethoscope either. So if clinically we are seeing a case that obviously needs more care, without thinking too hard about it, the answer is simply to treat them. With Lyme disease, the clinical picture is super important. Sometimes the clinical picture gives us way more info than any test ever could. They say that taking the history of a patient is 90% of the diagnosis. And I believe that's completely true, that knowing what is going on, seeing what is going on with the clinical picture gives us so many answers that a test may not be able to help us with. Most of the patients that I see here when I treat Lyme disease are patients that have already been through multiple tests already, and those tests are coming back negative. Their Lyme test might even come back negative, but yet they continue to have symptoms. Symptoms that fit the picture of someone with tick-borne disease. ILADS has a definition for chronic Lyme disease is largely based on the clinical picture. They state that Lyme disease is a clinical diagnosis. How can this be? If this is an infection, can't we simply just get a test for this? In theory, that would be wonderful. That's why we develop tests, is so we know what we're treating, so we don't have to just rely on the clinical picture, giving us confirmation of what we already thought in most cases. But testing, as we know, for Lyme disease is not perfect. And I've gone over this in more detail in other videos. You can certainly click on the link here to take a look at that. But what I want to focus on is why it's so important to treat clinically and why it's important for us to treat until those clinical symptoms resolve. There are so many cases where patients have treated for the recommended course of care according to the CDC guidelines, and some even longer, that still aren't better, but yet their doctors have given up saying, I have nothing else to offer. Let's send you to a rheumatologist. Let's send you to a psychologist. We just have to treat the symptoms. My experience has shown that you can treat a patient to symptom resolution or at the very least, symptom management to a point where patients are comfortable, to a point where patients are feeling better, where symptoms are very manageable and aren't controlling their lives. But it's very important for us to continue this treatment and use those clinical cues as our deciding factors. I think the thing that we always got to ask ourselves too is, let's say we go ahead and we do testing. If we've got a clinical suspicion that someone has Lyme disease or other tick-borne diseases, if that testing comes back negative, what will you do at that point? Will we still treat? Will a test result change the way that we treat a patient? I think these questions will really help us gear, when a test is helpful, when it's not. I still do think, and I still do practice with the model that if a patient hasn't tested for Lyme disease, I'm still going to test them. I'm still going to check, even if the clinical picture looks positive. But that doesn't necessarily mean I don't treat them if they come back negative. That just simply means that if they come back positive and confirm our suspicion, or if they come back positive for certain co-infections that would alter our treatment, we can use that then to move forward with confidence, knowing what we're tackling here. The same thing goes for discontinuing treatment with a patient. What is the deciding factor that tells us that we can stop treating, that this patient is better? There unfortunately is not a lab that can do that for us. And I think that that's one of those areas too that's still a little bit misunderstood, that there are some even practitioners that will use labs as a marker as to when they can stop treating somebody, as to when the infection is gone. Keep in mind that the labs really only show us whether or not someone has produced antibodies towards a specific organism. In a chronic disease, they can't tell us when they got sick. They also can't tell us if the patient is better. Lack of antibodies, as we already discussed, does not rule out the illness. The clinical picture is still key here. In fact, people can continue to test positive for a very long time, even after recovering, after treating and feeling better. So we certainly cannot use these lab tests as a marker and a way for us to determine whether a patient's treatment is done or not. It really, again, is that clinical picture. How are they responding? Are they better? Are their symptoms remaining? Are the symptoms that are remaining potentially related to tick-borne disease? And sometimes the best way to find out is to simply assume that we are at a point where we can discontinue treatment if we feel like we're confident in that regard, and then monitor. Because again, I said it a million times in this video, the clinical picture is going to show us what happens next. A patient that has not fully recovered will likely have a recurrence of symptoms. And I have found that for a lot of patients, that's going to be the case. And it typically will take more than one round of treatment for us to really see that lasting relief and lasting benefit. So just as a summary, look at the patient. The patient is not simply a lab. The lab values, the lab results are not what make up that patient. There are so many cases in many, many areas of medicine where we cannot rely on labs or tests or imaging to give us a complete picture. And so we really have to keep in mind, what does someone look like when they step into our office, and what can we do based on that to help them?